Call the November meeting of the Wood County Board of Supervisors to order at this time. I have a few supervisors that need to sign in yet.
Oh, you're trying?
Or one anyway that's trying.
Okay, thank you. Thank you.
And the roll has been taken. Noted that Supervisor Handler is excused. Called her this morning. And I guess she'll come up. At this point in time, we would call on Supervisor Roser to come forth for the invocation. While she's working her way up, I'd ask the body to please rise, and then we will remain standing for the Pledge of Allegiance.
Good morning, everyone. Will you join me in prayer, please? Father in heaven, thank you for the blessings of this day. What a privilege it was yesterday to honor veterans and to recognize our military personnel around the world. We pray for the safety of active service persons. We also pray for military and government leaders as they make decisions to keep us safe in an ever-increasingly evil world. Help us to take the responsibility we have in our positions seriously as we deliberate the issues on our agenda today. We're honored to serve Wood County in this capacity. Thank you for our many blessings and help us to be forever grateful. Help us to be caring and compassionate toward those who are less fortunate. In Jesus' name we pray.
Amen. Please join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, John. And Supervisor Roser certainly mentioned it, but the Pledge of Allegiance takes on probably a special meaning today, over the day immediately after Veterans Day. And again, a thank you to all those veterans who served or are serving today, because we would not be here today. We would have not gone to the polls a week ago. None of those opportunities would exist without the sacrifices and contributions that they have made. So a sincere thank you on behalf of this board. Minutes from the previous meeting. I have a motion to approve by Fire, a second by Nelson. And this is on the minutes of the October 21st Wood County Board meeting. Is there any discussion on those minutes? Any discussion? All right, seeing none, all in favor of approval, please signify by aye.
Aye.
Opposed? And that carries. Minutes are approved. We do have an excusal today. Like I said, Supervisor Handler, who reached us this morning. We have no resignations this month. We have no appointments. We have no reappointments. Do we have any public comment today? Is there any public comment? Anybody from the public wanting to speak before the board? Smith. Doesn't look like it. Acknowledgements and recognitions. We have none this month. We do have one special order of business today. Linda White's from the ADRC will give their annual update. And I see we do have a few visitors in the back of the room. We have the economic development people here from both Marshfield and Wisconsin Rapids. Reggie, I see the university is represented back there, to Deanster and Michelle. So I want to thank you for your attendance at today's meeting. I guess that gets us into the packet today. A lot of what we will be dealing with is the budget, which we started discussing this morning with the executive committee meeting and the budget hearing. So, into the packet. Anybody else have anything before we get into the packet? All right. And I hope all these pages are still in order, because I was flipping around when we were doing budget. Page 5 of your packet. Mike Martin's monthly letter of comments. Page 6, more of the same, as well as 7. The Human Resources monthly letter of comments on page 8 and 9. Systems on 10, 11. Maintenance is on 12. Safety and risk management on pages 13. Presentation you saw this morning goes from pages 14 to 28. Pages 14 to 28. Anybody have any additional questions on those? I know you asked some this morning already, but any additional questions on those? Pages 14 to 28. Anyone there? Page 29 in your packet is the first resolution from the Executive Committee, as well as Health and Human Services. And I'd ask the clerk to please read the resolution.
This will be Resolution 14-11-1 to amend the 2014 budget for Edgewater Haven Nursing Home Therapy Function for additional expenditures that were not anticipated during the original budget process. Fiscal note, the source of the funding is higher than budgeted revenues within the therapy department and a transfer from contingency. The adjustment to the budget totals $160,000.
A motion by Clendenning to approve, a second by Hamilton. Under discussion, I assume we have an amendment to this also. Go ahead, Supervisor Roser.
Thank you, Mr. Chairman. I don't think I'm on, but I can talk loud enough.
I don't think any of those mics are on up there.
They're not very high.
I don't even think if I talk louder, it's going to pick up anything. This is a significant amendment, so I'd like for everybody to make sure to hear when I come up there. Thank you, Mr. Chairman, for allowing me to do this, because I do have a rather significant amendment. In the fiscal note, I would like to omit the words "and a transfer from contingency." I will explain why we do not need money from contingency. So that sentence will end with, "The source of the funding is higher than budgeted revenues within the therapy department, period." Then under the accounting of where the money is going to come from, I would like to change account 46525, which is Medicare therapies, from $70,000 to $150,000 and eliminate the $80,000 from contingency. Then in the third whereas, I would like for that whereas to now read, "Whereas the higher than anticipated expenditures can be fully funded with the higher than anticipated revenues." So partially will be changed to fully, and then the little section there that says "with the remainder from tax levy contingency," that will be eliminated. Then in the "therefore be it resolved," we will change that to read, "To amend the 2014 budget for Edgewater Therapies," and then that number, "for the $160,000 by appropriating $80,000 of unanticipated revenues from the Medicaid therapies for $10,000 and the Medicare therapies," and that number, "for $150,000 other than 70. So then we're eliminating "and a transfer from contingency for $80,000. So I would like to amend this resolution, and then after I get a second, Mr. Chairman, I would like to speak to that amendment.
Okay, Mr. Minor wanted to second that amendment, so we have a motion and a second on the amendment. Discussion on the amendment.
Thank you, Mr. Chairman. When this resolution was originally presented to the Health and Human Services Committee, there was, and it went to the Executive Committee, where a further discussion took place about why are we paying for this out of any contingency. So Amy, our Edgewater Haven administrator, we started talking about we knew there were increased revenues coming. Where were they going if the therapies section of our budget was not increased? Well, the more we talked about it, we realized that our revenues from therapy come from inpatients at Edgewater Haven, and they also come from outpatients at Edgewater Haven. So the outpatient revenue was being put in a certain account. But there is something called a RUG rate that is determined for how much we get reimbursed by inpatients at Edgewater Haven. And that RUG rate includes x-rays, lab, pharmacy, nursing care, dietary, housekeeping, laundry, activities, and maintenance. All the things that we need when people are inpatients at Edgewater Haven. But the other thing that it includes is therapy. And so those therapy dollars that were additional revenue dollars were going into another account. So we could, which was over, we had additional revenues in that account. So that is the account that we're going to take the $80,000 out of instead of going to contingency. We also made a change in the budget where we eliminated the therapies, the outpatient therapy dollars, where we're going to deposit those money, and we put nursing rehabilitation as a category in the Edgewater Haven. So now all the therapy dollars will be deposited into that account, out of which we will pay expenditures. So this should never happen again, because now our therapy dollars are going to go into a new category, which then will include the additional revenues from therapy, out of which then we can pay additional expenditures that should come when we have the additional revenues. Does that make sense?
Further discussion on the amendments. Supervisor Clendenin.
So, if I may address Donna?
Absolutely.
So let me get the track record on this. First, there was a resolution by the Health Committee or the Human Services Committee. Then it went to the Executive Committee. And and then did it go back to the Health Committee again then?
No.
So this all come out of the Executive Committee, that this is a way to do this? So why? I know we're talking about the amendments. So why wasn't a new resolution just drawn up indicating this? Why the amendment? I just don't understand that, how all this could transpire and no meeting took place, because I would have liked to have been in on the discussion just as a learning tool.
Okay. The reason, and this is my understanding, is there's no change in the total budget. It's only the way we're getting to the total budget. The bottom line did not change. There was a lot of discussion about, if we've got the additional revenue there, why are we taking this out of contingency? That's inappropriate. So the bottom line didn't change, Bill. That's why the amendment is appropriate. The budget still stays the same. It's just the way we are coming to that budgetary line. And it's a financing thing, so it was appropriate for the Executive Committee to go in this direction.
Supervisor, let me go to Supervisor Curry, then I'll come back to Supervisor Minor.
Thank you, Mr. Chairman. Can I address it, the chairperson? I think I've got this in my mind. So the $80,000 from excess funds was just going into a fund. That money wasn't being expended at all. It just had a place to go.
Because the therapy for inpatients was part of the RUG rate, it went into the nursing category, because that's where the reimbursement dollars were deposited. But therapy was part of that RUG rate. So because our revenue was higher, because our therapy unit has been generating additional revenue. Our new therapy wing is doing what we wanted it to do. It's increasing revenue for the organization. There was just a disconnect because therapy for inpatients was part of that RUG rate, and we weren't pulling the therapy dollars out to cover the additional expenditures now that were occurring because we're seeing more patients.
This is kind of a what if, but I guess my question about that is there any other accounts this is happening in where we're moving money and not expending it inside budgeted expenditures? It's an unfair question because you're going to say you don't know.
Well, I know part of it, but Mike, I think, probably is going to need to answer that, because we did change a category from nursing to rehabilitation, and we're not really moving money.
Well, no, I could understand that part, and I appreciate the change in how we're accounting this. my concern is there any other, should we be looking at the future? Is there any other circumstances this is happening?
I don't believe so, but I'm going to
I
have...
have one more question for you,
Okay.
Madam Chair. Is that an acronym? The RUG, you're using the word RUG here. Is that an acronym?
It is, and I'm going to let Amy speak
Okay,
to
great.
exactly what that stands
Thank-
for.
thank you.
And you know what?
Go ahead, I'll go to Amy and then we'll work our way around the room here in this discussion.
Okay, I'm going to try to explain this to everybody. When we budget for therapy department, our revenues for therapy department are our Medicaid, our Medicare Bs, and our private pays. And those are the only revenues that go into that therapy revenue account. When we budget for our RUG rates, which includes all those things that Donna said, the RUG rates are driven by therapies. The higher level of therapy they get, the higher our RUG rate is. So we get more money if they have more therapy. And just to give an example, if somebody is a Rehab Ultra, we will get like $576 a day, and we pay therapy $101 out of that $576 a day. So if you look at our overall budget, those RUG rates were in the nursing department. The nursing department revenues are over by $2.1 million, which covers the other departments, so that they're not covered by tax levy.
Any RUG rate, it's
It's a resource utilization grouper, and for Centers of Medicare and Medicaid, we have to put all this data into a computer, and it's called a minimum data set. All that information goes into the computer with the minutes from therapy, and then the computer spits out from CMS a RUG rate, and that's what we get paid, a daily rate. And the reason why we haven't split those revenues out and put them into therapy is because when you get a rehab person, you do a 5-day, 14-day, 30-day, you have to keep doing all these MDSs where your RUG rate can change. You might be an RV where we're paying the therapy company $75 a day, and after 7 days they may go to an RU where we're paying them $101 for therapy a day. So your RUG rate changes so often, it would be very difficult to try to break out each one of those therapy things. So I sat down with Mike and talked to Mike about it, and we decided to amend the 15 budget for Edgewater and have the therapy/nursing department all as one, because therapy is what is driving our revenues.
I didn't mean to chuckle, but it reminded me, about a year ago, I addressed the human services people when they're in town. They all talk in acronyms all day long. I read a 2-paragraph statement that had 2 words that weren't an acronym. So you need a sheet, and maybe we can get one someday that explains what all of those are, because it gets somewhat difficult. I was like, even the explanation contains 15 or 20 acronyms, but it is an accounting. Trent, do you want to go, and then I'll go back to
Mike, I guess I would defer to the finance director if there were questions, because I can't remember what they were for him now. If there are questions for you, Mike, if you want to answer those, then I'll take a stab at Supervisor Clindenny's.
Yeah, we've gone one of 2 ways as far as dealing with this. It's always our goal is to match program revenues with their related expenditures. And in this case, it was a challenge because, just like it was talked with, all those acronyms, and accounts have theirs also. But we probably went overboard as far as splitting out therapy as its own cost center and its own revenue generator, because it was difficult, if not undoable, to split all the appropriate revenue. Because again, it's all grouped in with that rating of each patient. So we made the decision, instead of trying to split out the revenue, which would have been perhaps imprecise, to just combine therapies and nursing together. But it is always our goal, and it's a challenge to always show a program on its own as far as what are expenditures and what revenues does it generate on its own. Because we'd like to know as far as how much does that program need to be subsidized. And this was misleading in the fact when we adopted the 2014 budget for therapies, it looked like it was 50% levy, 50% Medicare and Medicaid, and truly it wasn't. And so we've gone away from the presentation that was in 14 And in the 2015 budget, nursing rehabilitation combines those two, and then all the revenues are appropriate for that combined area, rather than trying to do a split.
And I would think, if I might just add that, it's even more appropriate because it's the therapies that drive, in large part, that revenue source.
I'm going to go to Supervisor Mahan. In your hand.
Question answered.
Answered. All right, back to Supervisor. Oh, good. Supervisor Hamilton?
Just a quick question. So we're not moving money out of another account and shorting that account? Okay, that's, I thought that was right. I just wanted to make it.
We actually, for 2015, eliminated the therapies account because that money now will go into the nursing rehabilitation category so that the expenditures can be paid out of the account that the revenue is going into.
We're always trying to clean it up as much as we can. Supervisor Minor.
There's no question that there are gremlins in a lot of these different budgets. We've been dealing with this in Highway Department. We've dealt with it in Human Services. I mean, there are certain gremlins that exist because of how funding comes in and how that changes over time. I'm going to try to rely on my memory, which is a bad idea, but if I'm not mistaken, that therapies line item came when we privatized, when we went to the contract with therapy, and it was put there so that the Health and Human Services Committee and Edgewater could distinguish, okay, is it doing what it's supposed to be doing? Is it saving us money long term? After hearing all this run rate and all this stuff that gives me a headache, it wasn't appropriate to have those split out like that. As far as the timing, Supervisor Clendenning, that was the whole reason I wanted to speak, was really we didn't have any of this discussed or decided on at the Executive Committee, hence the reason for the amendment on the floor. After more homework was done, it's like, okay, where is this money? Because Lance was right. He spoke to this at length at the Executive Committee meeting, that this just doesn't make any sense. We signed the resolution going forward. It certainly could have been pulled if we didn't get an answer we want. It could have lost if we didn't get the answer we want, but this seems realistic and the proper way to go, including with the Finance Department as well.
Are you going to acknowledge that I made sense once this year? Supervisor Clendenning.
Oh, I'll address now. Let me put this into perspective. The Judicial Legislative Committee wants to co-sponsor of a resolution or has to send it to the Executive Committee. If the Executive Committee gets this and makes the changes like were made, I would think that the people that are serving on the Human Services Committee are wondering how this all come about, or on the Judicial Committee. We send it to the Executive Committee, and all of a sudden, there's an amendment from the floor, and you know, they're the ones that understand RUG and all this stuff. I would imagine that they're at a loss. How did this resolution come before us now with such a drastic change? And why is the hurry up about it? This could be done next month.
Oh, I think if we turn around and talk, if I may, Mr. Chair, if we talk to the finance director, he very much dislikes spending into negatives, especially at this dollar amount. There are state statutes that even guide that we can't appropriate funds that are in the negative. Hence the hurry up. But no, the Executive Committee bill did not change this. Hence why the amendment is on the floor. The Executive Committee did not change, and the amendment is actually coming from the chair of the Health and Human Services Committee, which is appropriate because that's where any budget resolution does come before the Executive Committee, just because it has to get run through the Finance Department. So to say that the Executive Committee is changing this, that's not fair and it's inaccurate, I believe.
And I certainly, as chair of the Health and Human Services Committee, I certainly am open to any of my committee members standing up and saying that they disagree with this and don't support the amendment. But I go back, Bill, again, to the fact that there was no change in the bottom line of this resolution. It was just that I think it's great that we're not using contingency money for this. We figured out where the money was going, and we're trying to fix it by the amendment to the resolution, which of course I support. Thank you.
All right, additional discussion on the amendment. Any additional discussion on the amendment? We'll try this by voice vote. All in favor of the amendment signify by aye.
Aye.
Opposed? No. All right, back to the resolution as amended. Any further discussion on the resolution as amended? Any further discussion on the resolution as amended? Okay, please vote. The resolution passed 18-0. Thank you very much. Page 30 in your packet. A resolution brought forth by the Seed Committee, co-sponsored by the Executive Committee.
This would be Resolution 14-11-2 to amend the 2014 budget for junior fair for additional expenditures that were not anticipated during the original budget process. Fiscal note, $32,000 additional cost to Wood County from contingency funds. The adjustment to the budget is as follows. This increased expenditure will be offset by not spending $32,000 in junior fair funds in 2015.
Okay. I have a motion by Hinkle to approve that, a second by Clendenning. Any discussion on this resolution? Supervisor Lynch.
Thank you, Mr. Chairman. I guess I'd like an explanation as to why we're doing this. Is there an issue up front?
Supervisor Minor.
Supervisor Hinkle.
Either one of you, both chair on committee that's named that resolution.
Thank you, Mr. Chairman. We had a presentation by this fair manager explaining that this was a temporary cash flow issue, and he was very clear that they were working on making sure that things were a lot more transparent about how funds were used. The Seat Committee felt very comfortable in unanimously approving this kind of a advance. If you'll notice one of the, at the bottom of the, I think it's the second therefore, it does specifically state that there will not be any other expenditures this year that they will, in 2015. This is 2015 in advance.
I'll allow further discussion if you want further explanation. I think I saw Adam in the back of the room before.
He is back there.
Manager.
Do you want more?
Adam, are you back there? I got heads in front of me.
He was?
He was.
I saw him in the building
Earlier.
He had to leave a little early.
He had to leave a little earlier. Yeah, he just had a long explanation for both of his committees. And I thought this was Supervisor Wagner?
Yeah, I am one of the two county reps on that board. And yeah, it is a cash flow problem. They are working very hard to correct it. There'll be a meeting, I think, next Monday night, where I think some of the options to the committee is going to be presented. Adam regretted very much having to do this, but it was nevertheless necessary just for the short term.
For clarification too, I believe, and Mike, correct me if I'm wrong, instead of getting the money in January, they get it at the end of November, basically. Supervisor Ashcraft.
Well, I probably was the instigator of this to start with. We have a little cash flow problem now to finish the year off, and our new fair manager has different ways of trying to organize money for next year, mostly through the business people in Marshfield, and just to give him a chance to get his feet established as new ways of financing the fair. To give him a temporary fix to his budget this year, because we just wanted to use it to help us get out of the year. So, thank you.
Any further discussion on this resolution? Any further discussion? Please vote. Al, you're not in yet. That resolution also passed unanimously, 18-0. Brings you to page 31 in your packet, resolution from the Executive Committee.
This will be Resolution 14-11-3, tax deed eligible property. Authorize the tax deeding of property in compliance with Section 75.14 Wisconsin statutes. Fiscal note, taxes for 2009 through 2013, $18,151.46, plus special charges, publication fees, tax deeding expenses for a total of $32,832.49.
A motion by the manager to approve, a second by Bry. Is there any discussion on this resolution? Any discussion? Please vote. Again, that resolution passed 18-0. Page 33 in your packet, another resolution from the Executive Committee regarding acceptance of the offer of sale of tax deeded property.
This will be Resolution 14-11-4 to accept offer of sale of tax deeded property. Fiscal note, offered amount of $70,480 minus real estate taxes, special charges, publication fees, abstracting fees, for a gain of $51,551.57.
Motion by Henkel, second by Clendenning. Any discussion on this resolution? Any discussion? Please vote. That also passed 18-0. Thank you. Linda, if you'll bear with me on the ADRC one, I'd like to get through this, through the budget issues here, and then when we get back into the packet, we'll start there. I hope you don't have to run out of town immediately. Okay, thank you. Page 35 of your packet, a resolution from the Executive Committee in regard to establishing the tax levy.
This will be Resolution 14-11-5 to establish Wood County's tax levy for 2014, collectible in 2015. Fiscal note, $22,795,568.
We have a motion by Supervisor Minor, a second by Supervisor Bry. Is there discussion on this resolution? Any discussion on this resolution? Supervisor Hamilton.
Thank you, Mr. Chairman. Is this where I do it? Okay.
No.
Of course, you do ask.
I'm not listening to you. I didn't ask your opinion.
Yeah, next question.
Next question. Here we go. I don't think that thing is working, so I'm just going to speak up a little bit.
They're working on it. Try using it because he's working on it while you're back. They're trying to make this work.
Okay, I can, yeah, but, all right, well, let's see if it works or not.
It doesn't matter.
What I would like to do, whoa, there we go.
No.
Actually, Brad, it's the next
It's
one.
the next
I'm
one.
honest to God, swear on a stack of Bibles, it is the next resolution.
I'm not sitting down until he says I got to sit down.
Okay,
I'm kidding. Is it the next one?
yes, it is. Okay.
The budget, not the letter. Andrew.
We have a motion and a second. Is there any further discussion on this resolution? Any further discussion? All right, please vote. That resolution passed 17-1. 17-1. Brings me to the second resolution, Brad, I'm sorry, page 36 of your packet. We've got notes all over these from the previous meeting. And as soon as the clerk gets set, I'll ask her to please read that resolution.
This will be item Resolution 14-11-6 to approve year 2015 budget. Fiscal note uses and sources totaling $100,687,485.
Okay. On the resolution itself, Bill, was that a motion to? No, it wasn't. Supervisor Henkel with the motion, Supervisor Wagner with the second. Okay, we have a motion and a second. Discussion. Now, Brad.
There you go. There we go. Okay. What I would like to do is, I am in opposition to the recruiter position at this time, and I guess I just don't think it's needed as of yet. I think what we need to do is look over some of the reasons why we need more. I know we got that packet, and I read through it twice, and I appreciate how she wrote it up. But I just think that a recruiter position, we need to fix some other things before we worry about recruiting, getting a recruiter, if at all. So I would like to make a motion to move $72,500 from the HR budget to undesignated.
Undesignated fund balance.
Thank you, undesignated fund balance, and I'm being helped, and I don't care if anybody likes it or not, I like it. Just because I would like to see this like to see this held off for at least a year and looked over. Thank you.
Okay, I have an amendment offered by Supervisor Hamilton. I need a second to that amendment. I have a second by Supervisor White. Discussion on the amendment. I'll try to catch everybody's. All right, discussion on the amendment. Supervisor Minor?
Yeah, Brad, I was going to give you the first shot if you had any more to say since you're doing the amendment. Do you have anything else?
Do you have anything else right now? No, but if
Okay,
you argue with me
then
tonight.
I'll speak to it. I do think the HR director has put forth a very reasonable, very
Compelling.
compelling and fact-driven proposal. We are missing the boat when it comes to recruitment. Why some people leave, maybe it's not the best fit. The recruiter helps with that. She's giving you numbers which are substantial in the tune of about $500,000. That was all listed out by position. She's done an excellent job presenting the facts to you on why it is needed within that department. You look at counties around us, they do have staff dedicated to the recruitment. Wood County should be a place that we get the best and the brightest. And I think we're missing the boat on that with the current way we do recruitment. A lot of this will have to come with the advent of the computer system. I'll call it computer system, otherwise I'd use another acronym that I can't even pronounce what it is. But the new computer system, the days of doing paper applications are over. And that's just not the way business runs anymore. It has to be convenient for these people. We shouldn't have our face out in these universities, getting the best graduates we can. We should have relationships with them. That's everything that a recruiter does. They're a cheerleader, I think, for the county and county employment. If we find the best and the brightest, I think that we will see the retention rate there improve. A lot of the department heads support this because it does help them even with their hiring. It helps the county from a liability where we're compliant. We make sure that we're asking appropriate questions during the interview. Having this farmed out to different entities sometimes can be problematic. The decision will always remain with the department head / oversight committee on who gets hired, but this is a great tool, a needed tool, and I will not be supporting this amendment. Thank you.
Okay, we'll continue discussion. I'll go to Supervisor Curry next, then Clendenny.
Thank you, Mr. Chairman. I too don't think this is necessary at this time. Creating a recruiter position attempts to solve a problem. I don't deny, I read through our human resource manager's handout. You can't disagree that we need to hire people. And I won't disagree with Supervisor Minor that we should hire the best people we can. But do we understand what our problem is now? The causes of the ability to hire for certain positions. It looks like a lot of our positions are in Edgewater and with CNAs and nurses. The possible causes, and you can bring up a lot of those, are we paying at the appropriate rates? The work conditions, are we providing the best work conditions for employers or employees, or can they go out and find better jobs? Why are they leaving? We don't know that. Our management style is right. So before we try to solve this problem, we should know what is causing the problem. If we just hire a recruiter, it's just like a puppy mill. All we're doing is bringing in people that we don't know if they're going to stay or not. I don't buy into what Supervisor Minor says. Just because you hire the best people, don't mean you're going to retain them. So I will support not hiring this person.
All right, continue discussion on the amendment. Supervisor Clendenny.
Thank you, Mr. Chairman. There was a statement made that now that the unions in Act 10 are not available, there's still a lot of work to be done. I disagree with that. I know during negotiations and stuff like that and grievances, I remember when there were several grievances on the table and spent a lot of time, and I went through them because I was a union president. I even know that just for HR people in the private sector, especially New Page, when I was union president there, we must have had 8 to 10 people in HR. Now I think there's one for each division. I just don't think the time is being utilized that I've been to several meetings where our new HR director has been to, and I think she's great. I think she's probably one of the most intelligent HR directors that I have seen and heard of, even in my union times. But I just think it's too quick to come into this department and say, we need this after 37 or 38 days in the department. Yes, she's an improvement over what we had, I agree with that, but I just don't see, it's what I'd like to see, and I think part of this motion is where are you going to do with the funds? And I think land conservation needs somebody. You know, put it over there, I'd be in agreement with that, but I can't see this position for them, and I will be voting against the position.
Further discussion on the amendment, Supervisor Roseman.
I wonder if it's oh, confound it, I don't like not being heard. Oh, there we go. Thank you. I'm wondering if it is not appropriate for perhaps some of our department heads who are spending a lot of time recruiting people. You know, I have the privilege of being chair of a committee where we have a lot of 24/7 folks and that employees, and that presents a whole different way of looking at hiring those people. And I've heard from our department heads what a struggle it is in order to employ those people. And Mr. Chairman, with your permission, could we open it up to have some of the department heads comment about how much time they spend with with recruiting and bringing people in to support to support this position and speak against the amendment. Is that appropriate?
It might be. If we get through this, I'll ask the body if they want to grant that when we get to that, when I get through discussion here from the board members. Further discussion on the amendment from the board members. Supervisor Hinkle.
Thank you, Mr. Chairman. I do not support this amendment. I strongly support the creation of a recruiter position. I do not have a large number of employees underneath our oversight committee, but we have seen 2 vacancies in one department. People are trying to cover those vacancies at the same time that they're trying to recruit. It puts a burden on our employees, and you know that we have slimmed down everything on the county level. We don't have extra manpower up there, person power. It is a terrible burden when we have long-term vacancies. And I think that since those occur when we're recruiting the way we have been doing traditionally, we have to look at a different way of recruiting. I certainly agree with Mr. Clendenning that our new HR person is very good. Therefore, why don't we follow her recommendation after she's studied it, presented things to us, and given us the numbers?
Supervisor Mahan.
Thank you. No, I'm not. Well, that's right.
It's very select.
Keep talking.
Thank you, Mr. Chairman. I am not questioning our new HR director's qualifications at all. I have not had that much to do with her, but the presentation I thought was well done. But it has been my perception that in the past, we have purposely left jobs open as a cost saving. And this, again, is my perception, but we have done it purposefully as a cost saving measure to the county in some cases. And I think that we have dragged the filling of certain positions at times. And again, that is my perception. And so I don't think that holding off for a short amount of time is a bad idea here. Thank you.
Thank you. Supervisor Wagner.
I know in management, which I've been privileged to be in for a lot of years, and especially in management in government, one thing that is driven into you over and over again is you try and save an employee rather than terminate or dismiss an employee. You try and plan well in advance for retirements. And the reason you do this is because the cost of replacing that employee is about 25% of the salary for that position. That's the rule of thumb that you always use. So in government, where we're trying to be responsible to the taxpayers, we try and minimize the turnover as much as possible to save that 25% of that salary, which is really unproductive money. It's really unproductive money when you're going out searching. I think this position is a new wave in the way we do business. I think it's a new concept in the way we do business, and I understand the resistance because it has that nasty aroma of change about it. And I know we don't like change too much. But I think this is a way of making sure that we minimize the cost of replacing personnel and doing it. I'm going to oppose this. I'm going to oppose this amendment and support the resolution. Thank you.
Thank you. Further discussion on the amendment, and I'll go back around the second time. Further discussion on the amendment. Supervisor Winch.
Thank you, Mr. Chairman. I guess a lot of the things that I'm thinking of have probably already been said, but and in her summary, she mentioned overtime, and I'm not an advocate of overtime, obviously. Checking with Mike Martin, we didn't pay any overtime. The other side of an overtime issue is that sometimes it makes sense to pay a little bit of overtime rather than hiring someone new, with benefits and etc. And my experience over the years is that employees will tend to get the job done in the time allotted. And it appears that we're getting that job done because I don't know of anybody that's on a waiting list for services at whatever level. And some of these jobs that remain open for a long time, it's my feeling that if they're remain open for such a long time, maybe they're not real necessary. Some of those things that Mr. Curry was talking about need to be looked into before we create a new position. Thank you.
Anybody else first time around? Supervisor Minor.
If I may, Mr. Chairman, Finance Director Martin, could you respond to Mr. Lynch on the overtime, because I believe you have numbers.
Yes, I did look into that, and there's likely some miscommunication between Supervisor Lynch and myself as far as that we didn't pay any overtime. We might not have paid overtime like within the Human Resources Department itself, but we certainly have overtime in many of our departments. The budget is right around $450,000 for overtime, and our actual overtime, because of a way that we account for overtime in highway, is even larger than that. So, no, the budget for overtime each year is in the neighborhood of $450,000.
Let me have a follow-up with Supervisor Winch, just because it's the same thread of conversation.
Thank you, Mr. Chairman. In talking to Mike, like he said, that there was no overtime paid in Human Resources. That's what I was referring to. But something else that came up, or came to thought here, is a few years back, we were paying a substantial amount of overtime in the Sheriff's Department. Look at it today. It was unnecessary overtime. We eliminated that with the new sheriff and with the committee. If there is overtime being paid, I think it needs to be looked at whether it's necessary or, what's the cause. Thank you.
Supervisor Rosen.
Thank you, Mr. Chairman. I just have a couple of comments to that. Number one, we're talking about salaried individuals very often picking up a lot of overtime. Yes. Supervisor Hinkle mentioned people that are doing, picking up the slack in their departments because there's a position. Those people are salaried. They're not, they're just doing what they need to do. So they're probably not turning in overtime hours. They're just working harder and longer to fulfill the responsibilities of their job. And this position wouldn't eliminate human resource time. It would eliminate a lot of the time that our department heads and supervisors are spending trying to recruit people to fill positions in their department. I think that all of us that are chairs of committees, we encourage our department heads to look at their organizational structure when they have somebody retire or move to another position. Continually, we say to our department heads, can you do this differently without that person? Can you organize your chart so that you can decide whether that person is necessary or not? I think we've been very diligent about doing that in our departments. So I think, to answer Supervisor Winch's comments, is that this is a much broader issue than just overtime and whether the Sheriff's Department is saving money because of wonderful reorganizational things that they have done in that department. And I don't want to the trees that are in the forest by not looking at this in a proper perspective.
Let me go to Supervisor Mahan and back to Clendenning.
Thank you, Mr. Chairman. I thought I'd be working this time. Two questions here, I think, and I agree with Supervisor Rozar that it is a broad issue, and I think it's worth the discussion here today. Number one, I would like to make the point, correct me if I'm wrong, but when department heads are working overtime, it becomes comp time, which is not a dollar amount to us. So I think that makes that a moot point to some extent. Secondly, and Mr. Martin might be able to answer this, if we have budgeted $450,000 of overtime, if we're budgeting $450,000 of overtime, somebody going to tell me that $72,000 position is going to make that go away? I don't think so. That's, again, perception on my part, but we're budgeting $450,000 worth of overtime. Somebody's got to make me see that a $72,000 position is going to make some of that go away, and then I'll support it.
I'm going to go to Supervisor Clendenning, and then I might ask that question. I don't know that it's fair to have the finance director answer that question, but I do have some department heads here, and I know that was vetted in their department head meeting, and I may go to them if that's desired. Supervisor Clendenning?
And that's what I'd like to thank you, Mr. Chairman. And that's what I'd like to address. The department heads, I think, have no part in this discussion. It's voting on a motion. They're not going to vote. If you people wanted them, you should have had a meeting with your department heads. We did. I did. I had a meeting with the Judicial and Legislative Committee, and we had this on our agenda. And to have department heads come up here where I can see who is for this and who is against this, naturally they're going to come on the side that wants to pass this resolution the way it is. I think it's unfair to have department heads speaking to this. That could have been done on your individual times. Right now we have an amendment, and that's what we should be voting and talking about.
That's noted. It is proper, though, to ask the body to allow that discussion if they so would like. But I'll finish with the conversation first. On any supervisors wanting to comment or further discuss this amendment. Supervisor Ryan.
Mr. Chairman, I would like, because it is coming out of her department, I think to have Connie explain and then maybe answer some of the questions that have come up. I do believe that would be appropriate. And with permission of the chair, I would like to ask that the HR director take the microphone and maybe answer some of the questions that have come out today.
Can I do this? Well, that's always appropriate. By a show of hands, at least, would the body allow some latitude and some input from the department heads? If you're in favor of that, please raise your hand. That's more than half, I believe. Okay, let's try our HR director, Connie. You want to take the microphone for a second?
So I appreciate the concerns that everyone has expressed. I want to just reassure you that my number one priority in coming to Wood County is to be a good steward of the taxpayers. Through my 25 years of HR experience, I have never spent money unnecessarily. I don't believe in it, I don't advocate for it, and I can't support it. If I can't prove something on the numbers and based on my past experience, I will never come forward with it. As a point of reference, I went out to market on a limited basis this year to look at some of our benefits because I believe that we had an opportunity to increase our benefit offerings at no additional expense. And my findings were that in a limited market search, we were not able to do that. So I never brought it forward because I don't believe that that would have been a responsible stewardship action to be taken on my part. I can tell you that if you look at the numbers of the amount of time that it's taken us to place positions, there's actually an inverse relationship between the growth in the economy and the availability of applicants. So whereas 2 years ago we were placing people in 13 weeks, now it's taking us almost 17. And as the economy continues to improve, that is going to become even more of a challenge because those people are already gainfully employed, where a couple years ago they weren't. There was a huge surge in unemployment and it was easier to find people than it is now. So now we're having to go out and we're having to take a more active role in looking for people and asking for them and seeking them out. We can't just put an ad out there anymore and get passive or active applicants. They're not applying with us. We don't have the visibility at job fairs, we don't have the visibility at schools, we're not partnering, we're not planning for the 25% of our workforce that's going to retire within the next 8 years. We don't have a backup plan for that. We need to really be active, proactive in looking ahead at these things. Our department heads cannot do that. We have a completely decentralized recruiting process right now. Department heads are on their own. They don't get support from HR. We place the ad, they get the applicants, they look at them, they make the decision, they do the interviewing. They don't receive the support from us. They should be receiving the support from us. We're the people who can really help them make better, more cost-effective, more time-effective decisions. And so that's what I'm asking is to just take that time that the department heads are spending on this and put it into a centralized position who can see the broader scope of what's happening at all places and really make good use of their costs and their time. And to the point of, can we make that $450,000 in overtime go away? I believe we can make a big portion of it go away, yes. If you look at the last few pages of the presentation that I gave you, it was an estimate on what we paid for critical only positions. Now that's not department heads, and it's not departments where we maybe could benefit from having that position placed. It's where we have required staffing census numbers, and we have to put a body in there. So if there are 5 or 8 or 12 empty positions at Norwood, the remaining people have to be working those hours. And it's burning them out, and we're turning people over at a much faster rate than we need to be. In terms of whether or not we're competitive against other counties, we are, based on a cost of living that is rated for our area. But within a 45-minute commuting distance, people can make 20 to 30% more than they're making in Wood County. We're not the position of choice at this point, but I believe that we can be through this and a few other actions that we can take to increase our visibility, to be looking more proactively at the future, and to really be thinking about what our needs are going to be going forward. Obviously, things like making our application process a paperless process are going to be helpful as well, because that does add some additional obstacles to the application process for people, especially for the newer workforce. But again, I would be willing to tell you that if I cannot prove to you that this results in cost savings, I won't keep it for 2016. Because I believe so strongly that you are going to be impressed with the results that I just don't think there's going to be any question. I've done this multiple times. I've started up multiple HR departments. I'm a Six Sigma workflow nut. I don't believe that you just do things without the numbers attached to them and without the data to support it.
Thank you. My intention wasn't to line up a bunch of department heads in addressing Supervisor Plendenning's question either, but if I have one of the supervisors or a committee chair who specifically wanted somebody to speak to this issue as it relates to their department, I would allow that. Or do you think you've heard adequate support at this point? I want to hold on to that.
I would call for the question.
Okay. We're going to do this on the board, okay? We are addressing this as it relates to just the amendment. I'll wait till you put up voting. Okay, you're voting just on the amendment, all right? Just the amendment. So if you're voting yes, you're voting to support the amendment, all right?
Which takes away the position. Correct. Yeah, there.
All right,
That's what yes means.
so please vote. And that resolution failed 10-8. So that takes us, or that amendment failed 10-8. That takes us back to the resolution in its unamended form. Back to the original resolution in its unamended form. The amendment fails. Is there any further discussion on the resolution? I'll let Cindy catch up here in a second. All right, any further discussion on the resolution? Okay, if not, please vote. And the resolution passed 11-7. Resolution passed 11-7. All right, that is page 36. I'm going to go to, we've had extreme patience from Linda Weitz, who is the executive director, the director of the ADRC. She's here for her annual update. We're 40 minutes past due with that presentation. Linda, I really appreciate that. Why don't you come on up to the front? Do you guys want to take a quick 5-minute break real quick? Yeah, let's do that so nobody's walking out during the presentation. Is that okay, Linda? I'd rather everyone listen to that. All right, let's take a quick 5 and then back up. All right. If I can get the body to come to order. Linda Weitz is the director of the ADRC, and I should know that because I was the first chairman of the ADRC. I should know another acronym, the Aging Disability Resource Center, for those of you who have not been involved. And we've had tremendous amount. We started at the beginning when we founded the program, and I had the opportunity to serve in that capacity. Hildy Hinkle followed. As I think right immediately, probably after I chaired that particular area, I have my fire Doug Mahan there right now, and it's been an extremely beneficial program to our county. And Linda is here to provide her annual report. She promised she'd keep it short and sweet and hit the high points, and then if you have any questions, we'll move that direction. So Linda, the floor is yours.
All right. Thank you. And I just want to thank you, Chairman Flemel, and the rest of the board for letting me in your agenda today. I know you have a lot of important things to do, but 10 minutes of your time is really important to me. So at your desk, you'll see a very brief, that's why we're trying to keep all this brief, summary of services at the ADRC of Central Wisconsin. I'll use the initials since Lance kindly explained what the ADRC stands for. The ADRC of Central Wisconsin provides integrated services with a goal of supporting health and independence in older and disabled adults. Simple stuff, right? But the other thing that we do, by providing these services, we also make a financial impact by delaying, reducing, or eliminating the dollars needed for publicly funded care. That's what we're here for, folks, is to keep people healthy and independent as possible. What services do we provide? In the sheet that I passed out, we've grouped those in 4 main categories of services that we do provide at the ADRC of Central Wisconsin. We provide information. We connect people with resources and benefits to keep them healthy. Again, there's a lot of resources out there that keep people as healthy and independent as possible. We enroll them in publicly funded benefits, such as family care or IRIS. The only way that people can access publicly funded services is to come to the ADRC. But one of the things I do want people to realize is the vast majority of the people that we see, you see the 20,000 contacts that we make throughout the 4 counties, the vast majority of those people don't ever end up in publicly funded care. We're out there to help people preserve their resources, preserve their financial health, and to at least delay that impact of publicly funded care. We also serve nutritious meals. Our nutrition program is one of our critical programs that we provide to keep older adults healthy and independent. We provide Meals on Wheels and congregate dining for that population. I have to mention also that we've just entered into a new 3-year contract with the Norwood Healthcare for providing the food for our nutrition program, and we're thrilled with that contract. They do a great job, they provide great food, and we're glad that we're going to be working with them for 3 more years. One of the challenges that we have in our nutrition program is that we need to adapt to the changing needs of our older adults. We all know the baby boomers are turning 60, and they're a different group, we've been told, as far as what they're looking for services. And our classic nutrition programs might not best meet their needs. So we've been awarded an innovation grant for the ADRC of Central Wisconsin to look at different ways of delivering services. And what we are going to be doing with that grant is that we're going to expand a program into Wood County that we've been successfully piloting in Marathon County for a number of years. It previously was called the SNAC program. We've now renamed it to the Cafe 60 program. And what the program is that instead of a traditional congregate meal site where older adults come at a certain time, eat their meal at a designated time, 11:30 during the day, and that's the only time that program is available. What we do is we contract with restaurants in the area, and they provide a designated nutritious meal that our registered dietitian has set up at that restaurant, and older adults can receive coupons for the payment of a suggested contribution. We can't require anybody to pay for their meals, but we suggest a contribution. They receive these coupons, then they can go to that contracted restaurant anytime during the day and turn in their coupon and get that nutritious meal. So we're expanding that program into the Pittsville area of Wood County, hopefully by the end of the year, because a couple of years ago we had to, it's gritting because he knows the work that we did to make this happen, we had to close a traditional congregate site in that part of the county a couple of years ago due to lack of participation. So we're hoping that this will better serve that area of Wood County and looking forward to that. The other area of services is certainly promoting healthy living. We have community health educators that provide classes to keep people healthy. We focus our efforts in evidence-based classes because we want to make sure that the research is out there to show that what we're doing has some intended results. And I think you've all heard from us before. We can't provide everything that needs to be done in the county though, so the other role that we play in our Healthy Living program is to facilitate those opportunities in our communities. So we get leaders trained that work for other entities. We try to incorporate those opportunities throughout our communities to make sure that they're sustainable. One great success story that I have here in Wood County is that our Marshfield Fire Department, who's been very supportive of our falls prevention efforts, one of their firemen, I guess we call them, fire department employees, received training in our Stepping On program, which reduces falls prevention, and he's teaching a Stepping On class in Marshfield. Interestingly enough, we had a lot of men sign up for that program, whereas in the past with all of our women community health educators, I don't know if that made a difference. But that'll be a program that'll be able to be continued in that community. We're just thrilled with that partnership. The other area of services that we make sure that we focus on is supporting caregivers. When we serve older and disabled adults, we recognize how important it is to support those caregivers, whether it's a spouse, daughter, son, friend, neighbor. Many people provide caregiving services, and that's a very critical issue in our communities. It impacts workplaces, it impacts ability to be productive in your jobs, because these are working people that are many times caregivers. So we provide the information, resources to support those caregivers. On the back, how are we funded? Hey, how are we able to do all of this? So our primary funding sources are about 40% of our revenue comes from state contract that we have that incorporates federal and state dollars to provide Aging and Disability Resource Center services, ADRC services. That's about 40% of our budget. About 40% of our budget comes from federal and state Older Americans Act funding, particularly targeted for adults age 60 and over. That's about 40% of our budget. Only about 14% of our budget comes from tax levy from our 4 member counties of Marathon, Wood, Lincoln, and Langlade. In Wood County, and I think I'm right here, Mike, I got the dollars in front of me. Tell me if I'm wrong, Mike. Okay, anyway, Wood County contributes $198,278. And that's easy number to remember because it has not changed since we were formed in 2006. I want to make that point. Not changed, not an additional dollar has been, Wood County has given us through those years. How are we structured? I do want to mention this. We are a truly regional organization through the 4 counties with one management structure, one budget, one executive director, me, and we fully integrate our aging and ADRC services. And I just need to mention that because as of late, the ADRC of Central Wisconsin has received, and I'm looking at Chairman Plumel here and many of you in the audience, we've received a lot of recognition for the structure that our organization is. And it is seen as a model across the state of Wisconsin as the structure that they would like to see other ADRCs and counties provide. So I just want to thank all of the leaders in Wood County. Many of them are in the room today. I understand, I was not here at the time, but forming our ADRC Central Wisconsin organization was no easy task, but they did it right and they did it well. And because of their hard work, we have a successful organization today. Any questions?
Supervisor Clendenning.
Thank you. Yes, I've served with you on many committees and organizations, and I just want to let you know that I'm proud to know you, and the fact that we have a recruiter position, I wish you would put in for that.
Thank you, Bill. I listened very intently to that discussion, and okay, I'll write that down. Thank you.
Supervisor Collins.
Thank you, Mr. Chair. On your contracted restaurants in the county, what percentage do you have that are contracted and those that perhaps are not?
Okay. Right now, the only restaurants that we have in that program are 5 rural Marathon County restaurants, and they were particularly targeted for their geographic location because the purpose is to serve as an alternate to a congregate meal site that we normally would place there. The advantages are that we don't have to have personnel costs sitting there waiting for somebody to show up. So they're specifically targeted geographically. So the new one now in Wood County, we just researched restaurants in the Pittsville area because of where it's located and who really wanted to join us. Yeah, researched. Didn't take us long. Supervisor Lazar, yes.
That's only because I'm behind Linda.
We researched that very hard to find out who was available. But we did find one that is interested. So.
Supervisor Wagner.
Linda, thanks for the report, appreciate that. There was some discussion when I served on the board among the other counties about the difference in the funding formula. And I know the Finance Committee was looking at that at one time, or talking about looking at it. And the disconnect was between population and services. You know, in other words, Langlade County by far is, I think, the smallest in population of the 4-county consortium, and yet they require they get a good chunk of the services out of it too, and they did. Mm-hmm. So the question was, have they addressed that issue, or are they playing with that issue, or?
Yeah, and I'll just fill in a little bit to what Supervisor Wagner is referring. When the organization was first created, there is a 4-county intergovernmental agreement that everybody agreed to. And of course, a critical question at that time is, okay, how much tax levy is each county needed to contribute to make this organization provide the consistent quality services that we have throughout the 4 counties? So there is a percentage in the intergovernmental agreement that all counties agreed to. The discussion now has been, should we revisit that and determine whether we should look at a different formula? Just as an update, we have not revisited that again, but we certainly can do that, so.
Questions? Again, I don't want to leave anybody out, but there's been a lot of people in this room that have been extremely instrumental in the success of this particular organization. The 660301 agreement that was put together, that intergovernmental agreement has become a model throughout the state, and that was done with great help by our corp counsel, Pete Gassenholz, as well as Tom Finley out of Marathon County, who has since passed away. Mike Martin was absolutely instrumental in putting together the finance part of that puzzle. And then we've had, like I said, the people who have served, not just on that board, but served that aging community in town. And I'm going to miss somebody, Bill Clinton, Marion Holcamp, for sure, Ed Wagner, Mike Fire, Doug Mahan, and there's probably more that I'm missing. But it has been a very successful program, and I think the important part is it was done because we saw an ever-increasing budget in this area, and we've been able to stabilize that for 8 years now.
You bet.
So any other questions? Director White, Supervisor Rosen?
Linda, thank you. It was a wonderful presentation. I appreciate all the information. I just want to make sure that people understand the relationship between the ADRC and the managed care organizations, because I think that a lot of people don't understand that you are actually the qualifying agency for people to come into like CCCW. And I am the board member that represents this area for CCCW. And of course, now that we've increased our geographic representation, our board has taken on a different composition. But we appreciate what you do in helping to qualify people for the services that the managed care organizations provide. And maybe you could just say a few words about that just for educational purposes of how you feed into those people we serve.
Yes. The Aging and Disability Resource Centers were created as a part of the long-term reform movement in the state of Wisconsin, looking at a new model of how we can provide, effectively deliver publicly funded long-term care to those who need it without the extensive waiting lists. We all remember those waiting lists, horrid waiting lists, which were gone now in Wood County. And part of the model that was created was, as Supervisor Azar had referenced, locally the services for family care is provided by a managed care organization, the new name, CCCW.
Yeah,
let's say initials anyway. They changed their name. And the role that the ADRC plays is we are the objective place that people come to determine eligibility for those services. And I emphasize objective because they were created. That's why we have board members that can't serve on both, because we are supposed to have a separate function to tell individuals to determine eligibility and to keep those decisions about eligibility and enrollment separate from the managed care organization that of course might have a little vested interest as far as who's enrolled. So that's our role. So anybody who may need publicly funded care has to come to an ADRC.
And thank you, Ms. Chairman. If I might just follow up on that. Chairman Plemmel already said that reorganization was done to stop these rising costs that were going on. And so this whole long-term care reorganization in the current structure of how we help people who are frail, elderly, and developmentally and physically disabled, all of that was done to try to do it more cost effectively and more efficiently.
And keep those costs down. They were just bleeding money. So.
Anybody else? Supervisor Clendenny.
The transportation now, it started out with the transportation and now that's individual counties?
Yes. As a matter of fact, the individual counties always provide, Marathon County's transportation was always separate, Lincoln and Langley was always separate, and Wood County was always part of the Wood County Department on Aging. So when we first formed, the ADRC of Central Wisconsin also provided that function, but now that's been returned to Wood County as well.
Thank you very much.
Thank you
for your time. Thank you for your patience.
Thank you.
Yeah, thanks. All right, now for your favorite part of the meeting, pages 37 to 60 are already done. That is the budget and what we went through already. So we will go to page 61 in your packet, and that is the Health and Human Services Committee meeting of October 27th. That is 61 and 62. Starting on page 63 and going through page 67 is the monthly report from the Health Department. That's 63 through 67. With each of these, I'll try to give you enough time to see if you made any notes there or if you had any questions. On page 68, the Wood County Human Services Department report, beginning with Director Redder's report on page 68, and that goes page 68 through 71. Page 72, Veteran Service Officers report. Page 73, the report from Edgewater Haven. The Wood County Public Safety Committee of October 14th begins on 74, 75, 76, 77, and 8. The Humane Officers report through September 14th on 79, as well as 80. The Coroner's report on 81, and it's about time we mention it, but Gary Cronstad has been the coroner here for how long, Tom? A real long time. He is retiring, did not seek re-election. We will have a new coroner early next year. So thought I'd mention that. And Gary, thank you for not here, but thank you for all those years of service. That's page 81. Starting on page 82 and going through page 87 are jail facts and figures. And obviously the Sheriff's Department in the other discussion got a lot of kudos for keeping their overtime down at 0. Congratulations. That always looks good. Page 88, minutes of the Judicial and Legislative Committee of October 22nd. Supervisor Clendenin.
Yes.
Supervisor Hinkle.
Thank you, Mr. Chairman. I just wanted to point out that there were no minutes from the SEED committee because we had a very long meeting on Wednesday, the day that the minutes were due. So you'll get a double dose next month.
Thank you. Now, Supervisor Clendenin.
Yes, thank you, Mr. Chair. On the Judicial and Legislative Committee, we're going over the Supervisor's Handbook. We're going over the rules and regulations. And if any supervisor's got any concern, just send me a note or send Lisa a note about it, and we'll put it on the agenda. Or we'll have several things on the agenda for the 18th. We have changed our meeting, excuse me, from the 19th to the 18th at 1 p.m.
So that's started on 88, 89, and 90. Corp Council's monthly report on 91. Child Support Agency on 92. And that brings us to page 93 in your packet, which is a resolution from the Highway Committee.
This will be Resolution 14-11-7 to regulate the use of implements of husbandry, farm equipment, on county highways and to provide a no-fee permit for said use. Fiscal note, no direct fiscal impact. The regulations are designed to limit damages to the county highways and the need to make expensive repairs to those damages.
You've heard the reading of the resolution. Do I have a motion to approve? Motion by Nelson, second by, I think I had Hokamp up there, second. Any discussion on this resolution? Supervisor Clendenin.
Yes, and this has come to the towns and the villages and the cities also. And this looks like kind of a model resolution, and I was wondering if towns or villages or city would have any questions on it, if we could come to that committee or go to the highway person. Yeah, there's a lot of questions on it.
I don't know how to answer that.
Yeah.
Supervisor Meisher? Yes.
Thank you.
I probably could have answered that.
You can't say yes, but they can.
All input is welcome. All right, we had the motion and the second. Do we have any further discussion on this resolution?
So I have a question.
Supervisor Roser.
So the purpose, this is a no-fee permit, but if you don't have the permit, then you can't be on the road. And is this just a way to regulate, to know who's on the road doing, I don't understand the purpose of the resolution.
Well, then now you are, if I may, Mr. Chairman, now you are fully briefed on the law itself, because it is a very confusing law. This is, and Doug, you better start walking up, because I'm going to be calling on you. This is a compromise between all the entities. I mean, the highways, the towns, the counties, the villages, the cities have said, geez, this heavy farming equipment is just tearing the you-know-what-skis out of our roads. What can we do to prevent this from happening? So the farm equipment manufacturers, the road, all the people came to a group and came up with this law. Nobody likes it, so to me that means it's a good compromise. But it allows them to run higher weights than they used to. It used to be at 80,000, now it's a 92,000 with the permit.
So they're doing more damage to the road.
Well, that was part of the compromise, and it all has to do with axle 8, Doug, help.
All right.
One of the questions I want to get, when this was first conceived, it was conceived by a whole group of people, the farmers, the art association.
Doug, can you bring that mic up a little bit? There you go.
Our association and just a whole host of people. The law did read before this 80,000 pounds. How this got started, there was a gentleman got picked up in Marathon County. He was 134,000 pounds, which is a lot higher than 80,000. So it stirred up a whole bunch, a hornet's nest through the farmers and the Highway Association. So this is a compromise, like Trent said, that have been put together. We're looking at E, which means they can run 80,000, if they're running like they should be, like the law has been forever, they don't need any permit. If they want to go up to 92, which gives them 15% more, which is more, not more restrictive, less restrictive, they're able to haul more. That was a compromise that all parties got together and made. At 92,000, it does have an axle rating of 23,000, and some of the concerns I have, you can go F, which doesn't require any permits. They can run on the roads, but we don't know where they're at. Some of our bridges most likely can't withstand the axle rating that they're going to put on these bridges. So as Wood County, as a highway department, we want to know where they're at. We're not going to make this painful. We just want to make sure we know where they're at, so somebody doesn't fall through a bridge, basically, or damage roads beyond what they should.
Did that answer, Supervisor Minor? I'll go back.
If I may, Mr. Chairman, and the state statutes have always had in them damages to highways. I mean, if you damage a highway, you are responsible for up to triple the amount of damage payable to the entity that that road lies on. That remains the same. I mean, but some of this farm equipment is just flipping huge. I mean, the stuff comes down the road and you got to take the ditch to make room for it. That stuff is heavy and can, in one evening, they can put 6-inch ruts into a road, a blacktop highway, because they're so heavy and so overloaded. And again, this does come from an incident, and this is a good compromise by all parties.
There's a lot of other things in this process too, meaning they have to have special lights when they're wider. This equipment's getting so big that they do need to make some changes on this, and they have. So I've been to several meetings throughout the state with farmers, local officials. I'm not sure all the local officials understand what it's about yet, but they seem to be getting up to speed on it. So I see most counties choosing option E, which means the permitting process. I don't see many of them going out there and saying, no, we don't need any. You can do that. You can do that and let them run 92,000, but my spin on this thing is you need to know where they're at, because there's several bridges out there that may be affected if you don't.
One more thing about that. They can't exceed the weight limit of a bridge.
No, if springtime postings and if there's a bridge that's posted at 10 ton, just because they have a permit, them postings take precedence over everything else. So,
Supervisor Ashcraft.
Thank you, Mr. Chairman. Some of the issues with the width and the height of these vehicles too, not only the weight. And we have farmers that are farming 5 or 6 different townships and maybe 2 or 3 different counties, and they gotta go to all these other places in order to see what their permits are for. So that does make a problem for these people.
Doug, you had a comment?
Yeah, that's true, Bob. All these permits are going to be posted on the state's website. So when we decide to take E, ours will be posted E. I know there's several towns out there that have already decided to take option E, and they are posted so the farmer can say, you know, I'm going to be running off different roads. They know what posting they need, or what they need to do. If we deny a permit, we have to give them an alternate route. We're prepared to do that. We've been working on that as we speak. So we're going to try and make it work. I mean, it's something that's been pushed onto us, and I think it's long overdue because there's been some damage on the roads.
So I have one more question.
Supervisor Roser.
Okay. So enforcement of this, that will fall on our sheriff's department. If you permit somebody and they're not supposed to be on a certain road and you find out they are on a road, there are some enforcement.
Yep.
There's an enforcement part of this.
Now, one thing about this permit that I failed to mention is that the law used to be 80,000. If they get picked up at 92,001 pound, that fine goes back to 80,000. They just don't get fined for 1 pound. They wanted to put that in there so that people wouldn't say, you know what, I get 5% on this, they just keep going up over it. So they made it pretty stiff that when the law says 92, they mean 92.
Any further questions or discussion on this resolution? Okay, I don't see any. I would ask you to please vote. Hildy, yours isn't in yet? There we go. The resolution passed 18-0. Brings me to page 94 of the packet, Aging Disability Resource Center, Central Wisconsin. Their minutes from September 11th. That's 94, 95. Page 96, same committee, the Finance Committee minutes of September 11th. That's 96. Page 97, the Fair Commission, September 24th, their meeting, as well as 98. Page 99, minutes of the Board of Marshfield Fairgrounds Commission of October 7th. The Wood County Library Board, minutes of July 30th and 100. 101 is the South Central Library System Board of Trustees. It's 101 and 102. The Director's Report, Assistant Director Report on 103. Minutes of the Spray Irrigation of Waste Ad Hoc Committee, minutes of October 21st and 104. 105. We gotta get them an acronym, that's kind of long.
We tried to work on it.
Yeah, I don't want any suggestions. That's a whole other meeting.
That is correct.
Their attendance sheet on 106, and I've been told that they are moving along in a positive direction. Brings me to page.
Together, you're saying.
Yeah, yes. Page 107 in your packet is the resolution relating to the life and public service of James Nicholas Howler, Jim Howler, and a number of you who served with Jim on this board, and obviously saw his passing just recently. So the resolution has been circulated. I would entertain a motion by Supervisor Rosar to approve, a second by Supervisor Hamilton. A voice vote. All in favor, please signify by aye. Aye. I want to note that that was unanimous, and then I would ask the board to please rise in silence in the memory and respect of Supervisor Howell. Thank you.
Someday I'm staying in for last year.
That takes me through the packet, unless somebody else has. Supervisor Nelson?
There's another supervisor that just passed away, though.
Yes.
Len Schreiner just passed away, for those of you who serve with Len, still with him on the HR committee. That will probably be next month, that just occurred. Next meeting is scheduled for December 16th. Certainly want to urge everybody out there. We had some people in attendance yesterday from the DNR and the Sheriff's Department. Those of you out there in the public, hunting season's coming up, be safe out there, follow those rules, and happy Thanksgiving to everybody. Is there anything else that needs to come before the board?
What do we do with this?
I'm not sure what it is.
Connie, if you would please, Connie, give a little update.
Sure, I spoke to a couple people. HR is just doing an information update. So we're asking, this is completely voluntary, you don't have to supply us with this information, but we do keep you in the database as part of Wood County's population. And so if you're able to provide us with that information update sheet, it will go into our updated database, which we're going to be upgrading very soon, and we want to make sure that we have the best available information in it. So it's optional, but we would really appreciate it.
All right, at this point, motion to adjourn by Henkel, second by Hamilton. All in favor, please signify by aye.
Aye.
Any opposed? That motion carries. We stand adjourned.